Okay, well, good morning, everyone. Thank you all for joining us for our weekly update this week. We have a pretty robust agenda. I've got several updates myself, but we actually have three speakers today to give some updates. And I want to start with our state representative, Ben Frederick. He has a limited time window, so I want to turn it over to him. I want to thank Ben for his leadership with everything he does representing Shiawassee County. We work very closely together. Ben has been a regular on these calls over the past year or so, and we're in constant communication about different issues related to state policy and legislation and whatnot here and how it impacts Shiawassee County. So thank you, Ben, as always, for being here and what you're doing to serve us here in Shiawassee. And looking forward to hearing an update on what's going on in Lansing. So go ahead, the floor is yours.
And I was able to unmute quickly this time, so that's a new tradition, Justin. I'll do that for you here.
Got it. You're good.
I appreciate being with you again and being able to provide an update. I really wanted to speak to the plan that was announced by the governor last week, because as you know from previous calls, one of my main concerns and drives in this effort with COVID response has been to have our state get a trajectory of some certainty where people, businesses, communities, schools are able to plan ahead, able to forecast, and provide some certainty and hope. And so I think it was a positive step that we did see the announcement of a plan toward normalcy. It's tied primarily to vaccination rates, scaling up 5 percentage points increments with different things being released in those increments, going from 50% up to an eventual goal of 70%. I think it's important that we have this established because the plan now is something that people can look to and again drive that certainty and forward planning. But it also allows there to be a robust discussion about how the plan can be refined, what types of things could be done to enhance it. So I'm going to be communicating on some of these issues in the coming days, but we have already identified some things that could be done to make this better. Presently, there's not a way to track those individuals who are Michigan residents who went out of state for their vaccination, which means that some of our border counties have lower numbers than they really should, and we aren't able to account for snowbirds who go to Florida or other more warm climates. And so we're looking to drive a solution to that would allow those individuals to be counted as well. We also, I think it's prudent to not have everything solely tied to vaccination when we have this really having been established as a necessity based upon the prevailing public health situation. So we see a part of the plan speaks to advancement being delayed if a region is above 250 cases per million, but there's not really a baseline for how we could continue to accelerate if we're happily at a point of minimal transmission or minimal infection spread. And I think there should be a commensurate minimum that allows us to advance as we proceed through these phases in addition to the vaccination side of things. So that would really reflect what is the prevailing condition of infection, what is the stress rate on our public health system. You'll all recall that was the original basis or genesis for these things, and it should be reflected there. And I think there's a number of different things, whether it's rate of transmission or some commensurate low figure for cases per million. There's something that could be done there in that. I also think that we should look to ensure that as CDC guidance is updated in any way that's more permissive than what may be within the plan, that we adopt that guidance immediately to allow us to be able to capture the momentum of advancements in our understanding and in protocols that are being worked on nationally. So those are some examples of some things that I'll be bringing forward that I think would allow us to refine this plan in a way. I also think we need to address the situation of, is there some type of an allowance for those who have received antibodies via infection, those that have been previously infected? What, if any, factor should that play? That is a part of what Israel measures as far as their own lauded, vaccination rate does have an additional calculation for those that are assumed within the population to have received natural immunity as part of the mix. So these are all things that are very, relevant to looking at this plan, but I think it's important to note that the fact that we have something from which to have those discussions and to form a basis for those refinements is very important. Previously, the open-ended kind of environment or waiting for a press conference to find out what's going on, I think really did exacerbate the stress and uncertainty that people were facing. So I think we should capture this moment to make sure the plan's the best it can possibly be, and that'll be my goal, certainly, as we try to move past this chapter. Thanks, Justin.
Thank you, Ben. I know you have a limited time. I do want to very quickly open up the floor. Does anyone have any questions for Ben? If you do, hit *6 on your phone. Anybody have any questions for Ben? Okay. Well, Ben, thank you. Appreciate your time as always. Anything new comes up, you have an open invitation to participate in these calls, and we will stay in touch.
Always a pleasure. Thank you.
Thanks, Ben. All right. Well, appreciate that update from our state representative. I want to go now back to local before we go back to state. Larry Johnson, Larry, once again, I think you are still the #1 attendee or #1 speaker we've had here over the past 13, 14 months. Always appreciate the partnership. And we've been working actually more closely together here in the last couple weeks on some employer connections. So we could talk more about that, but I want to give you the floor to give an update on what's going on. So Larry Johnson from the Health Department. Larry.
Thanks a lot, Justin. Can you hear me?
Yes, you're good.
Great. Well, good morning, everyone. I'm happy to be back again this week. I'm going to start with some good news for us this week. We are, I think we're trending in the right direction right now in terms of this spring surge that we've been seeing. We're on a 3-week decline in our positivity rate and in our daily cases per million. Last week we reported out 5,291 cases. That was an increase of 227 cases, which is down from our high this spring of 335, which was on April 7th. So our numbers are trending in the right direction. So I'm very happy about that. And then with regard to active cases, they're still high. I mean, we're still running at about over 1,200 active cases. We did have 7 deaths over the last 14 days, and we would like to continue to bring that number down if possible. We are looking at the Memorial Healthcare bed capacity. They've got 19 hospitalized and 4 in ICU. 57% of their beds are occupied. So that's one of the big factors that we look at. But with the falling infection rate, we're expecting that hospitalization rate will decline. So some good news to share. We've been on a 3-week decline. It got kind of ugly there in early April, and there's a number of reasons with the variants and the transmissibility of them, and just people kind of wanting to be done with this, and I think we all do. But the vaccine now is widely available, and vaccination rates are increasing and infection rates are dropping, and they go hand in hand, so that's good. Right now we've had 46% of our residents, eligible residents, have at least 1 dose, and 35% are fully vaccinated. This is tracking the state. We're a little below the state average, but pretty close. We're going to be pivoting now to a public health education campaign to try to encourage vaccination. For those people that might be on the fence, those people that just, they don't know if they want it, what we want to do is make it more convenient. And Justin was just talking about some business partnerships that we're working on. And that's going to tie into our public health education campaign. So this week we're holding a large clinic today. It's our final mass vaccination 2nd dose clinic. I think we're putting through 600 people today. On Thursday we're going to do a walk-in clinic at Venice Township Hall. So walk-in clinic. That's going to be our first walk-in clinic from 12 to 3 p.m. We'll have both Moderna and Johnson & Johnson available. As you know, Johnson & Johnson is now back online. And then on Friday, we're planning to have a walk-in clinic here at the health department. So we're pivoting a little bit. We did our first clinic with a business on site at Woodard. It was very successful. We had over 20 people that we got to. So we're going to continue to work with all of you that are interested. And I know many of you have been in contact with Jody DeFren on setting something up with regard to that. So we're excited about that. Vaccination, the number of vaccines coming to the county have increased substantially. So as I said, it's widely available. Your pharmacies, different locations have it. So we have some in storage right now that we have not been able to get out. So that's why you're seeing the weekly allocations were lower this week, because we've got to get what we already have out. We don't want to just sit on it. So we received 800 second doses this week, 230 doses we've sent out to our partners. We've reactivated the homebound program that went on hiatus when Johnson & Johnson went down. So we're going out and partnering with local entities in EMS to go and do these homebound individuals. Also, we vaccinated over 400 of our 16 and 17-year-olds with Pfizer. Remember, Pfizer is the only vaccine approved for 16 and 17-year-olds. And Memorial Healthcare did a big clinic in partnership with us. It was really good of them to assist us. And then we ran one ourselves last week. So we've got over 400 of our Shiawassee County 16 and 17-year-olds vaccinated. And this is really good for those students because they don't have to quarantine once they have the full vaccination and 2 weeks out. And that's been a real hindrance for parents and for schools. So it's been nice. And, we wanted to try to get this in so that the kids those kids could be vaccinated before they did the prom or the graduation and those kinds of things where they're coming together. So we're good on that. And then also there's word that Pfizer's going to get approval to lower their age to 12 and up, which means 12-year-olds to 15-year-olds that we have not previously gotten to will be able to receive the vaccine, and we will plan to do something with that in terms of a clinic. I don't know what kind of demand we'll have for that, but we shall see. So once again, in closing, I think our numbers are trending in the right directions. Summer's coming. I think people are excited to get outside. We're pivoting to a public health education campaign because we've got these benchmarks that I hope we can get to. I don't know if we're going to get to 70%, but I hope we do through vaccination and not just vaccination and illness. But I'm hopeful today. So with that, I will take any questions that you might have, and hopefully look forward to speaking with some of you.
So, Larry, I want to follow up on the employer discussion. And we, as you mentioned, and I mentioned before that, we've been working on that, trying to identify companies that are willing to host on-site clinics, not only for their workers, but also for their families. And then I saw an email yesterday from Grace in your office seeking employers, I think it said with 10 or above. So what is your goal if you want to do an on-site? How many people, I guess, would need to sign up? Would it be 10? You need 10 people to do an on-site?
Yeah, we're shooting for that because we can send what I call strike teams or smaller vaccination teams out to these businesses. So at first, we were looking to get at least 20, but right now I'm looking to get people vaccinated. So, to make it worth the time and effort that we have to put in, we have to be nimble for these new mobile clinics. We're not nimble when we're in a mass vaccination clinic because we got so much stuff and everything we got to haul. So, I would say 10 because with the Moderna vaccine, it's 10 doses per vial, remember? So we want to get to 10. We don't want to waste any vaccine. We've done a really good job with that. So that's kind of my thought, and we're willing to anywhere and anytime. So let's talk and let's get out to your facility if you've got people that want to get vaccinated and family members too.
Yeah, and I heard the term yesterday. You got to meet people where they are at this point, right? And I think, your ability, as you said, with your strike teams to go to people And it's not just, place of business. I know you are working with people that cannot get out of their house and things like that. So, but for any of the employers on the line, if you've not done so, I'd certainly encourage you to poll your workers. If you can get 10, or if not, be in contact with Larry and the team to try to get set up for vaccines. Does anyone have any questions for Larry? If you do, hit *6 on your phone, please. Anyone have any questions? Okay, well, Larry, definitely a better update than it was a few weeks ago. It's good to hear that the numbers are going down. And I will say, and I did say this on the call when you were on a few weeks ago. I have gotten it. I've got my first dose a few weeks ago at the Welcome Center. It went very smooth, super fast. It was like 20 minutes in and out. And 15 of that was waiting, so it was really easy. I think it's important, me as a community leader, I'm going to be out there talking about it, my experience with it. And I think it's important local people, local leaders are vocal. I think that's going to be critical for maybe some of those fence sitters to see their friends, neighbors, community leaders, are getting it and are okay with it. So I'm going to continue to promote that. My next one comes up in 11 days, Larry, so I'll be ready.
Awesome. I look forward to seeing you there.
Yes. So thank you for that. So, all right. Anyone else have anything? Last call for Larry. Okay. Well, Larry, as always, thank you. You also have an open invitation anytime you want to come on and give an update. But if you do, as an employer, want to get connected with getting some vaccines done at your place of business, please get in touch with the health department. Our last speaker today, a regular as well, Gary Jones from Governor Whitmer's office. Gary, the floor is yours.
All right, thank you, Justin. Good morning, everyone. So recently, the governor and lieutenant governor announced that Michigan has administered 7 million vaccines. So to date, 50% of Michiganders have received at least one dose, with 38% of Michiganders being fully vaccinated, moving the state closer to its goal of equitably vaccinating at least 70% of Michiganders ages 16 and older as soon as possible. Also recently, Michigan Governor Gretchen Whitmer, Ohio Governor Mike DeWine, Indiana Governor Eric Holcomb, Illinois Governor Pritzker, Wisconsin Governor Edwards, Kentucky Governor Beshear, and Minnesota Governor Tim Walz. So basically a collection of Midwest governors joined together to release a video on social media urging Midwesterners to get the safe and effective COVID-19 vaccine. So it's a coalition, essentially, of bipartisan governors in the Midwest, just urging people to get vaccinated. Also, the governor recently encouraged restaurants, bars, and other food and drink establishments across the state that was hard hit by COVID-19 to apply for $28.6 billion in federal restaurant revitalization fund direct relief being provided from the U.S. Small Business Administration under the American Rescue Plan. Registration for the funding began last week, April 30th, with the application itself opening on Monday, May 3rd at noon. The governor also recently received her second dose of the safe and effective Pfizer vaccine that was administered by Dr. Janae Caldoon. The governor joined 6 Grand Rapids teenagers serving as Protect Michigan Commission COVID-19 ambassadors and receiving their vaccinations as well. And last week, the governor set the state on a pathway to return to normal by unveiling the My Back to Normal plan as the state continues to push towards its goal of vaccinating 70% of Michiganders ages 16 and up. To facilitate this goal, the Michigan Department of Health and Human Services will base future epidemic order actions on 4 vaccination-based milestones that, once achieved, will enable Michigan to take a step towards normalcy. And as always, I'd just like to remind everyone there are dedicated resources online for people to stay updated with what's going on, either regard to vaccines at michigan.gov/COVID vaccine or michigan.gov/coronavirus, which is the catch-all website for all things pertaining to COVID-19 in the state of Michigan.
Great. Thank you, Gary, as always. Anyone have any questions for Gary Jones from Governor Whitmer's office? Any questions for Gary? Hit *6 on your phone, please. Okay. Well, Gary, thank you. As always, appreciate your regular contributions. And we'll definitely, as always, stay in touch. And you also have an open invitation for these calls, as always. So along with that, I do want to do a couple quick items before we wrap. We want to make sure, and I mentioned this last week, we want to make sure that we're being respectful of your time, that we're covering the topics that are important to you. So if there's anything that we're not hitting on, any updates you'd like to have from any particular speakers in any area, please definitely let us know. I'm going to send out a note this week to our contact list asking for topics as well. So if you have any ideas for future speakers, please reply to that message. Gary mentioned the RRF, the Restaurant Revitalization Fund, that opened yesterday at noon, $28.6 billion. As Gary referenced, any restaurant can apply. It also applies to a few other food-related businesses, coffee shops, bakeries. There's actually quite a long list. You probably saw that in a previous email that we had sent out. We did a webinar last week as well with the Small Business Administration talking about it. That webinar was taped. It's also on our SEDP YouTube page. But if any of you are in the food industry and you've not yet taken a look at it, I'd certainly encourage that. And then 3 items for your calendar. And you have actually seen all 3 of these by email, but I just want to reiterate. Tomorrow night, 7 o'clock, we're doing a child care webinar. We're releasing results of a community assessment that was done to identify the data that really shows how much of a need for more availability and affordability of child care there is in the county. But maybe more importantly, on top of that, we're going to hear about resources available to child care providers and ultimately companies to be able to address that shortage. And so through our friends at the Small Business Development Center, there's a free resource from First Children's Finance to help with some business planning and consultation to figure that out. I will tell you the punchline of all of this, a little sneak preview, is more employer partnerships with childcare. We are strongly encouraging companies to look at ways to be able to offer childcare benefits to attract and retain talent. So that's going to be one of the outcomes of this. So you're welcome to attend. It's tomorrow night. It will be taped as well if you're not able to make it. Next week on the 12th, Michigan Manufacturing Technology Center is going to have a lunch and learn here at the Armory. While they are a manufacturing-focused business, they do help companies in other areas. They are going to focus on ways companies can use lean. And lean is basically a way to help businesses get more automated, use more technology to streamline the need for labor. So we're all facing labor challenges right now across every sector. So if your business has labor issues and you'd like to learn how maybe some lean principles could streamline your efforts and maybe help address some of those talent shortages, you're very welcome to participate. It's going to be on the 12th at noon here at the Armory. There will be a virtual option as well. And then finally, this just came out this morning. There is a gentleman at Covenant Eyes, one of our great technology companies, that reached out to myself and Greg at the Chamber about hosting a conversation on health and wellness for employees and trying to collaborate, best practices, things like that. And so they wanted to have a conversation with area businesses. It could very well lean into some type of a health and wellness type group that could provide some good information for your own operations to deal with that with your own team. So that conversation is going to be next Thursday, the 13th at 10 a.m. And they have set up a Zoom call-in number, and that is in an email that was sent out to you this morning. So, 3 events here coming up in the next week. Hopefully, one or all are very relevant to your business, and you're able to. With that, I don't have anything more on the list for today. As always, I appreciate everyone's participation as we go forward. As I said, we want to make sure we continue to be relevant and make sure we're using your time wisely. So if you have any topics, as I mentioned, that you want us to cover that we've not been covering, please let us know, and we'll get future speakers on. With that, we'll call it good for today. I hope you all have a good rest of your Tuesday, and we will talk to you next week. Thanks, everybody.